Hey, I'm Dr. Bo Richardson, formal name Robert L. Richardson if you're trying to look me up on a computer somewhere. I work for Henry County Medical Center at Transitions Health, and we'll be doing primary care. I was born in Memphis and spent most of my younger years in Memphis, but my grandfather, many will remember, was the man who ran the cotton gin here. And so I spent most summers here. I met my wife here when I was 6 years of age. And so I would consider myself very much a Parisian as much as a Memphian. I was educated at the University of Tennessee, Memphis. I was a resident in internal medicine at UT Memphis. I was a chief resident in internal medicine at UT Memphis. I have been here at private practice, and then I went back and was an associate professor of medicine at UT, teaching inpatient consult medicine to upper level residents, and then I came back here to work as a hospitalist for 9 years. Well, you got to understand that when I left, they were still working on the tower. When I came back, they had a whole lot more hospital built in here, and I think the facilities are wonderful. I mean, I've worked in several other places, and I think one of the things that is special about here is the people that work here live here, and they're taking care of the people that are here, and it gives you kind of a different flavor. When you go to some of the bigger hospitals, they do a fine job, but they're still not your hometown folks. There's lots of people that I see that I had in my previous practice, and they were rooting for me to go ahead and start a private practice again, and so I think there's a few people who will be pleased. I think it's like putting on your old pair of tennis shoes. It's something that I've done for a long time. It's something that I enjoy doing. I like the personal relationship with patients, and most of the time they like it in reverse. So yes, I'm excited about doing it. You go from being somebody who's trying to help patients with sometimes the worst day of their lives to being the mother of the patient, where you try to look out after things that are going on down the road. You try to anticipate problems. You work with getting their medicines right. You have your own network of referrals, that people you like to work with. And so if everything's running right, your patient feels like they've become part of your family, and you're just looking out after them that way. My family's always been intimately tied into the University of Memphis. My great uncle was past president there. We've been long-term supporters. I love going to basketball and football games. I'm looking forward to both teams being good this year, so that's one of my interests and pastimes. I like sports of most every kind. I would like to garden more. That would be nice. I haven't had time to see after a garden in a regular fashion like you need to have it produce and behave. I have 3 children. My oldest is Elizabeth, and she works as a staff pharmacist at St. Jude. She not only sees it as a job, but as a mission, and really loves what she does. She likes going to work every day. My middle child is Emily, and Emily has been married recently to somebody from here in town that many people will recognize. She is close to finishing her master's degree in psychology and would love to go into counseling. What further education that she does is not clear right this second. Third child is Rob. He just graduated from college. He is working as a person who assesses elementary school and preschool children for their eye exams, and may end up being an ophthalmologist in the end.